some perfect Tanzania. Niacheni livio. Please let me be a woman.
We are therefore gathered here today to celebrate Kenya's health sector commitment and achievement in its contribution towards Sustainable Development Goal SDG 5.3 on FGM abandonment by 2030. We are also, the other objective is we are gathered also here to highlight Kenya's accomplishments and lessons learned in achieving a strong multi-sectoral response. And as you can see, FGM is actually a multi-sectoral issue. It's not only in health, it's not only in the judiciary. I think it cuts across. We are also here to share the experiences and visions of FGM health sector champions on achieving FGM abandonment. And I think one of our commitments as a country, I think we had given ourselves a very high target. We were supposed to have ended FGM by 2022. That is as per the ICPD 25. All in all, I think we are making a lot of improvements. From the KDHS of 2014, the FGM was still at 21%. And from the KDHS report which was released 2022, we saw some significant improvement. If we are talking about 13% within 8 years, then it shows a lot of improvement. I think it is commendable. But the goal is to eliminate, make sure that it is zero. I think that is all what we are looking for as a country.
We will be marking the International Day of Zero Tolerance for FGM on the 6th of February, and it's really a day for us to really renew our commitment, energy, and efforts towards reduction, ending FGM as part of our SDG 5.3 targets. When we do this, we really take time to celebrate all the hard work that is being done at community, at national, and also at international levels. The commitment really is there to end this harmful practice. So as was said, while the efforts are ongoing, progress is seen. I think there's still a lot of more work that needs to be done in order to end this very harmful practice. It is a violation of human rights. It is a form of gender discrimination. And from the public health perspective, it is also a public health crisis.
So we have a standing committee in NCAJ that it's called the Special Committee on Children's Cases. It deals with child abuse, it deals with FGM and all. They do a lot of advocacy. They track the cases that come to the courts. They engage the stakeholders on the challenges they face. And they have now incorporated someone from the Ministry of Health that gives expert advice on the medical aspects of child protection. The judiciary has also rolled out what we call the case tracking system. So what we do is that we feed information from stations across the country in that system. It will show the offense committed, say if it is an offense under the FGM Act, it is captured there. It also has the outcome. So even in the hotspot areas, you're able to manage them, like Migori, Kajiado, and Narok. So every month, at the beginning of the month, we send the information to a centralized system that is managed by the Department of Performance. So there we can be able to follow and track the data on FGM cases.
The task ahead of us as a country is huge and enormous. The strategies that we have deployed in the past will not work. The strategies we have deployed in the past will not work. We must change something. And to change something is to recognize the value of the local community leadership, build not the national administrative structures, the ones that Dr. Mulwa is able to call the DC and the police and all that. It is going to understand the community and changing them from the community level. Community leaders, the women, the men, the church leaders, the religious leaders in the Islamic faith, and all faiths, so that this matter is addressed from that level. Of course, recently released data on KDHS showed some progress that the country has made, having moved from significantly from 38% FGM in 1988 to 15% in 2022, which is progress. But the question that one needs to ask himself is this progress good enough?
I'm a sad Kenyan this morning, from what I've just heard, that at a high level meeting, we are saying FGM is a non-issue that we should not be discussing. Really? And we wake up every morning, our social media pages, and we see FGM happening every other morning. And when we see this happening and we say it's not a subject for discussion, then I think there's a problem somewhere. But that will not stop us. It will not stop us from doing what we have been asked to do. And I'm happy this morning that we have the 22 hotspot counties to actually share experiences on their strategies of addressing FGM. I'm happy to see a partner here who has really walked the journey with us, that is your FPF. And I hope my CEO here of anti-FGM board is here. It is our mandate as State Department through our anti-FGM board to coordinate all programs towards ending female genital mutilation in the country. I know, and I've heard, we are all aware that we were supposed to end this vice by 2022. It did not happen. But we cannot stop doing it. I know we have another commitment under the Generation Equality Forum to end all forms of GBV and FGM by 2026. But I'm not saying, we now say we want to end it by 2026. We can give ourselves another target before 2026 so that we ensure that by 2026, it will be a free country where all of us and all women and girls will be happy.
We have embraced community policing approach towards building a partnership between the police and the community so that together we create and maintain a safe and a conducive environment for all, including women and girls. We have also a Directorate of Community Policing, Gender and Child Protection at police headquarters that normally deals with issues of gender. Towards this end, ladies and gentlemen, the National Police Service works closely with the national government administration, officers in organizing fora where community safety issues are discussed and solutions are jointly agreed upon. This strategy has encouraged members of communities to provide crucial information, which has led to the rescue of potential victims, survivors, and apprehension of offenders. It has also contributed greatly to the number of reported cases, as previously most cases relating to sexual and gender-based violence remain unreported.
In consideration of the deep-rooted nature of FGM among practicing communities, we need to take deliberate and bold steps of involving men and boys. Men in the African setting are decision makers at household and community level. They are the gatekeepers of community culture, and their involvement will definitely transform social and gender norms in ending FGM. Engaging men confronts patriarchy, promotes behavior change, and promotes positive masculinity. In line with my topic of partnerships and coordination, it is paramount that all stakeholders and duty bearers work together to succeed in confronting this vice. Partnerships are key as it ensures that we build synergies in funding, strategies, and even ideas towards a common objective. Globally, an estimated 200 million women and girls alive today have been subjected to this harmful practice. Our CEO is one of them.
And every year, almost 4 million girls are at risk.
Niache nilivyo, please let me be a woman.
Yes, good morning. I'm Samuel Kimani from ACAF, University of Nairobi. Thank you. My question is to Honorable Oruoch. One of the things that came out was the low numbers, case load in terms of medicalization. How do you, and this is important, how do you reconcile the country laws that healthcare providers could be found guilty and actually accept the mistake vis-a-vis the professional laws that regulate their professional practice?
What do you think we need to do to motivate and build the confidence of healthcare providers to do what you expect us to do? Because that's what we are supposed to do, but we fear. That's why we have all those, did you say acquittals, and there is no prosecution because there is no witness. Professor David did not appear because he's very scared. How do we work together?
So thank you for the questions. I seem to be on the receiving end in this panel, but I'll try as much as possible to, of course, respond to your queries. Question on caseload. Yes, we have seen the statistics there, very low. But in the judiciary, we handle what is brought to us. We cannot get out there to go and investigate, arrest, and bring the charge sheets. That is the work of another department, ODPP, the police, and all. But speaking to the issue of why there are many acquittals, I believe it's all about documentation. It is the way we do our investigations. It is the way we prosecute these cases. Some of them, when they come to court, they're able to engage high-profile lawyers, sorry to say that. They're able to pay for legal representation. These are not poor people, especially the medical, the health professionals. So you cannot match a prosecutor who is overworked in the courtroom. So I think it's more about engaging through the court users committees. It is more about finding out ways of strengthening these cases when they come to court. Professor Ndavi, that you fear. I don't know why you fear. Do I look scary? The way I am here is the way I am in court. Because I don't think for health professionals, we really refer you to the Witness Protection Agency. You don't need to, you're experts. In fact, we rely on you a lot. So you really need to bring out this evidence without fear. We don't intimidate.
Okay, to just add on my voice, on witnesses who keep on disappearing before court. We as police officers, ours is to investigate once the case is reported, to record statements, and also to bond those witnesses to appear before court. But sometimes the complainants or they prevail against upon the witnesses. Some of them sometimes receive a cash so that they can disappear. But we as police officers, once we bond them, we give them bond to attend the court, we take our files to court. So if they don't come and we are not supposed to force them to appear, yeah, we don't force them to appear. We don't arrest them to appear before court. So we just talk to them, encourage them to appear before court so that that case can come to a completion. And also, at every police station and at divisional headquarters, we have court users committee where police are also under magistrate, religious leaders, even the public are members. So we normally prevail upon the court users committee to engage them. We also engage even the chief in the villages to at least talk to the witnesses to appear before court. Otherwise, we are not forcing them to appear before court. Thank you.
Yeah, I have a question for Honorable Oluoch. Like the Sexual Offences Act has been in force since 2006, but the public seems not to know that it's there. So what are you planning to do so that the community or the society knows that this laws are available that they can assist to get justice. Now, to the representative of the IG, the same is the public seems not to be aware of or not even understand that there's a right, the accused have a right to bail or to bond. What plans do you have to educate? Because some of them, when they see this perpetrator or the accused in the public, immediately after arrest, they think police wamekula kitu.
So mine is just to share that resource that we found in the anti-FGM board with appreciation and say that we are trying to follow those lessons in Bungoma now with the Sabaot elders who haven't yet come out in a united way and in a clear way against FGM yet. So thank you very much.
Just to echo the sentiments of one of our colleagues who was just speaking, what I wanted to ask is what is the IG maybe doing, because as we go sensitization, we were even going to the markets. I was going to the markets, engaging the elders straight away from the market and telling them about the effects of FGM. And sometimes we were using the IG, that is the office of the president, whereby we are using the chiefs. And the chiefs, some of the chiefs were so scared. They think now they will be regarded as they are now outcast from the culture. So is it possible that also the chiefs are also sensitized?
Okay, I think mine was a very straightforward and simple question from Madam here. It's all about sensitization of communities. You spoke about the Sexual Offences Act. You know, we are not really supposed to be doing advocacy in the judiciary. We are impartial arbiters. So we really have to be very careful, but we do the best we can. We don't really focus so much on education. It is about enforcement of the laws. But as I said, we do it. We do education. Even here, am I not doing education? So I said, if you invite me, I will educate wherever possible.
Okay. An accused person has a right to bail. The accused person has a right to bail according to the law. Whether at the police station, the OCS has that power to release him or her on bond and to appear before court. And also once in the court, now the court also has powers also to release that accused person. But when the community see this person, maybe the OCS has released him on bond to appear before court, then sometimes they claim maybe there's something that have exchanged hands. But once the accused person appear before court, then with us police now, it is our duty is now to look for witnesses, to bond them to appear before court. So on bail, the OCS has that power and also the court. On community awareness, we do, as National Police Service, we do the sensitization through community policing. As I told you earlier on, we have a directorate at Vigilance Police Headquarters that deals with community policing, gender, and child protection. This is a directorate that normally deals with community policing, and once they go out to sensitize the community, they normally engage the chiefs, the public and the chiefs.
Can we give a clap to the panelists? Thank you very much.
Tanzania cheni livio, please let me be a woman.
All protocols observed, ladies and gentlemen, good morning. Good morning. We are going to have a fun panel. As my able panelists just walk to the podium, so Dr. Edward Serem, what measures has the Ministry of Health undertaken to respond to female genital mutilation in Kenya?
First of all, we have the FGM policy, and we draw our strategic plans, activities from the policy. So at the ministry we have laid out activities for interventions against FGM. And this one, I think we've rolled it out. And at the national level also, we do partner mapping, both at the national level and other counties, for the partners, development partners and implementers partners, who are carrying out the activities on the activities and interventions for FGM. We have been told there are about 22 hotspots counties. And it could have been very interesting to hear some narratives and difficulties from the counties. However, I know we know. The other issue is, of course, resource mobilization. We do a lot of resource mobilization. You see all these partners, we talk to them. And of course, they have contributed immensely to the reduction of FGM. At the county level, of course, we do a lot of sensitization to the county health management teams.
Professor Patrick Ndavi, I'd like for you to share with us what are the lessons learned in training Kenyan healthcare providers to be agents of change and providing quality care to those affected?
This is a very big question because we finally realized the health sector was not contributing its weight in ending FGM. And as a university entity, the center has been involved in training of healthcare providers in end FGM, as well as providing quality care to the unfortunate girls and women who have undergone FGM. But we are not the only ones building the capacity of the health sector. The evidence available shows that, yes, some of the healthcare providers who have gone through training are members of the community. They have the same beliefs. They have the same values. The training, part of the training is on value clarification. So that our healthcare providers who come from Samburu, Narok, Kajiado, begin to reflect on some of those beliefs and practices they have held as truths through value clarification training.
Asante sana, thank you so much. Dr. Christina, so kindly let us know how the World Health Organization is supporting the health sector to address female genital mutilation.
Yeah, thank you so much. I think this builds well on what Dr. Surem and Professor Ndavi have already mentioned, but as the World Health Organization, I mean, we work at in three main areas. First is that we develop the evidence-based guidance and resources and tools and training materials, both on the prevention of FGM as well as the management of complications. So first, in terms of the resources, we have developed resources on the management of complications first. I mean, people think of the health sector as a place that people go for management of complications, and that is in fact true. And as Professor Ndavi said, we have to make sure that the training's in place, that the resources are in place for this purpose. And this is not just on the gynecological and the obstetric complications, but also on the sexual health complications, the mental health complications, and other intermediate complications that may result from FGM.
Dr. Edna, kindly let us know the role of the Nursing Council of Kenya in elimination of medicalization of female genital mutilations.
I think 95% of all nurses and midwives know that it is wrong to medicalize FGM. The 5%, perhaps we can give the chance of ignorance of the law, which once we train them, they should, but all of them should be aware. And they've taken the oath. We have the law, we have the code of conduct for nurses and midwives, and at the same time, we also have our scopes of practices, which stipulate what we need to do. In regards of the standards of education and practice, and all of these, we provide them at the entry level as they go to practice. So there is no excuse that they don't know. So the council is always ready. I mean, on a day-to-day basis, I provide evidences to DCI confirming whether this is a nurse, whether this was a criminal issue, whether this is what it is, professional misconduct and professional malpractices. I do not have the right answer, but I am optimistic that with collaboration and harnessing the already efforts which are there, we should ensure that we are able to provide this support and prosecution.
So we are honored to have one of, the advocates, the 80,000 nurses you mentioned, that the advocates and champion. We're glad to have one amongst us, who's Catherine Chacha. So Catherine, kindly let us know what you do as a healthcare provider to be an effective change agent, as Dr. Edna mentioned. Thank you.
Thank you so much. Let me start by saying today I'm a very sad person and also a very happy person. Sad because if this conversation had been there when I was 12 years, I would not have undergone medicalization of FGM. Happy because at least people are coming out to tell healthcare providers we are the change makers and we are not supposed to cause harm to very innocent children who have not consented over something that is not of any medical benefit. So as healthcare providers, one key thing I've realized is what Dr. Ndavi has said, we need to have value clarification. Because coming up from communities that practice female genital mutilation, sometimes it's hard to have a voice of saying no, because we feel the community will be against us. But I've realized person-centered communication is the way to go. Let us go down to the community in every department. If it's in the antenatal clinic, start planting the seed. That mother who is pregnant has a reason why they practice female genital mutilation, that once you take and listen to them, you can be the change maker. I can be the change maker.
And I would like to request Mr. John Letiwa to kindly tell us the role of men and boys in what role do they play, for example, in transformation of social and gender norms to end female genital mutilation?
Yes, thank you so much. Okay, as for us from Samburu, what the roles that the men are playing together with the boys in transformation of social and ending an end to this FGM. They are the custodians of the culture. That means that they are the experts. They are the ones who understand the traditions, the customs, and therefore everything that pertains to what the Samburus do, be it the rite of passage, like now the circumcision, the starting of any age set, like now, let's say the Morans who are circumcised, okay, the FGM, marriages, and any other rituals that are being done is an initiate of the elders who are now the custodians of the culture. And also, we also consider that our elders are the protectors of the community, and they protect the community, and also protecting the community, they also provide and making sure that at least the health of the mothers, the daughters, the sons, who in this case are the Morans, and everybody, they also take care of it. So the elders now decided, after long consultations, they said, there is no way we are going to fight with the government, and we cannot go against this, the constitution. So we are going to also to agree that we are going to bless our girls who have undergone the FGM, and then again, the girls who have not undergone this, who have not undergone FGM, we are also going to bless them. What we are saying now, the role that these elders will now continue performing together with the boys is to go to every village with our support from the health sector, with the support from the partners and all the other stakeholders and people of goodwill.
Ms. Esther Mugura, kindly tell us the role of the Directorate of Children's Services in protecting children from undergoing female genital mutilation. Thank you.
Thank you. The Directorate of Children's Services has the mandate of protecting children from all forms of violence. So in terms of prevention, we have community interventions. We are implementing community interventions that address norms and values within the community. Under that, we have something that we are calling the Spot It, Stop It campaign to end violence against children. And I want to just indicate that as the Directorate, we have the mandate of protecting all children from all forms of harmful practices. So in terms of this campaign that I'm mentioning, it focuses on all forms, including FGM. So we have posters that are talking about what to do in case of you see a child who has undergone FGM. And we also hold community engagement within the community under this program of the Spot It, Stop It campaign.
So, Bwana Chief, Bwana Assistant Chief, Hamadi, How has the administration, both the chiefs and sub-chiefs, dispensed its duties in preventing female genital mutilation in the community?
Thank you. Bismillah ar-Rahman ar-Rahim. Every chief and assistant chief have a target or a goal. Personally, I have to head 3 public baraza in a month. So that will help to end FGM. And I come from the community where FGM practice, Tana River County. Another thing is enforcement of the law. We educate the society or the community that there is Anti-FGM Act, Charlene Act, to bring the culprit into the book. Another thing is that promote education. We chiefs, we are in the public, we used to tell our community the only the thing that we can, no, education is the tool to end FGM. If you educate the society and they all are get educated, I think this challenge of FGM will reduce totally. Another challenge or another thing we do as a chiefs is fighting child marriage. In fact, this is common in our areas. Tana River, child marriage is common. In fact, in my sub-location, I form anti-FGM committee at the sub-location level. And we used to have a meeting every Friday. They have to brief. They come to my office, they brief me. We share information. Another thing is that I realize FGM now is taking place in major towns like Nairobi, not in the ground. Unajua huko vijijini ni rahisi upate information. You have headmans, you have that committee, nyumba 10. So in case of anything, huwa information inapita haraka inakuja. Those we follow up. Lakini unasikia mtu ako Nairobi, ako na state. Ukikuja Nairobi ukisalamia mtu habari, hawezi kuongelesha. Sasa utaenda kwa nyumba ya nani ujue kama kuna nini na happen. So this FGM inafanyika in major towns. Watu wametoroka ushago kwa sababu ya chiefs and assistant chiefs, nyumba 10, ma-activists. Tuwe makini, FGM inafanyika ndani ya Nairobi na Mombasa. Thank you. Wacha tu nifupishe kwa hayo.
Thank you so much to all the panelists. It was amazing to get all the learnings, all the sharing, all the information, and it really spoke to me that we need the different sectors, multi-sectoral, and we all each have a role to end female genital mutilation.
I think coming to the end of this meeting, I think there are several key issues, and we have the rapporteurs who are here, but I think we've come to agree and we've come to know that we still require to rejuvenate the momentum. We are not yet there. And I don't know some of the issues which you have proposed, issues of research, integration of this FGM into all the departments, and getting to agree on the interventions which are workable. Now, you've heard that the ground is shifting. There are no circumcisions in the villages now. They are shifting to town. What interventions should be put? I think that is now another issue which is coming. Resource mobilization. Thank you, Professor Ndavi. And I think all these resource mobilization issues requires a lot of advocacy. It is true that several years before, the government used not to put any resources, or Treasury used not to put any resources in family plan. I want to report to you right now, we are now at about 1 billion per year. That is in the Treasury. So, and of course now the government is committed that by the year 2026, it will be fully funding the family planning products. So I think it is the same strategy and the same issues which we need to focus on. So having said that all, I think perhaps it will call that we should call another meeting in future, very, very near future, because we need to operationalize the interventions which have come out from this meeting. And therefore, the rapporteurs at the Secretariat are going to put down all what has been suggested, the lessons learned, so that we come up with a raft of good interventions for all the sectors.
Yes, I'm perfect. Niache nilivyo. Please let me be a woman.